a clear blue sky. I should go and see some friends, but they don't really comprehend. Don't need too much talking without saying anything. All I need is someone who makes me wanna sing. Take me to your heart, take me to your soul. Give me your hand before I'm old. Show me what lovers haven't got a clue. Show me that wonders can be true. They say nothing lasts forever. We're only here today. Love is now or never. Bring me far away. Take me to your heart, take me to your soul. Give me your hand and hold me. Show me what love is, be my guiding star. It's easy. Take me to your heart. Take me to your heart, take me to your soul. Give me your hand and hold me. Show me what love is, be my guiding star. It's easy. Take me to your heart.
Good morning, everyone. Welcome to BT Live. I'm Kuya Eric, your teacher for the environment and a Ban Toxics Patroller. We will start in a few minutes. So let's get to know each other. So for those joining us through Zoom, can you kindly type your name, organization, and location where you are watching this webinar, so we can acknowledge you. Let's see. Okay, good morning again, everyone. Can you please type your name, organization, and location where you are watching us for this featured webinar. I am Eric Buado, a teacher for the environment and a Ban Toxics Patroller. And I'm here live in Quezon City. Morning, Dr. TP. Okay, good morning again, everyone. I'm Kuya Eric, teacher for the environment and a band toxics patroller. Kindly type your name.
Sir Eric, the chat is disabled. Maybe we can enable it so they can type where they're from.
Apologies. Let us just adjust the settings for Zoom so you may participate in the chat box. Again, we'd like everyone to please type their names, the organization, and the location where they are watching us live. Okay, good morning, Jam. Good morning, Dr. Andrew from Chicago, Illinois. Okay, Sassy Noses, Jeluin, and MBSN3. Okay. Okay, we are also with Miss Abigail Samante from Mabini College Incorporated from Daet, okay, Bicol. Okay. Sige. Okay, we have also someone from CW from Santa Elena. Morning. Sassy from Sassy again. Okay, we have lots of participants from Sassy. Good morning, everyone. From Mabini Colleges again, from Daet Camarines Norte. Okay, good morning, Miss Hannah from Mabini Colleges, Daet Camarines Norte. Okay, I'm Ellen from Daet Camarines Norte, Jane, Sir Ronel from Central School. Okay. Okay, so that's it for now. So let's officially start our program for today. So again, good morning, everyone. Welcome to BT Live. I am Kuya Eric, your teacher for the environment and a band toxics patroller. I will be your host for our Autism Webinar this morning. This event is organized by the Autism Recovery of the Philippines and Band Toxics. Some gentle reminders for our guests in the Zoom room. This webinar is recorded and is live in the Band Toxics Facebook page. So please kindly mute your microphones while our guest speakers are presenting to avoid any audio feedback or interference. Kindly take note of your questions, or you may post them in the chat box for our guest speakers to answer after their talk. For those who are for our Facebook audience, please write your questions at the comments section of our Facebook page. We are deeply thankful and happy for everyone who joined us today for our featured webinar. We would like to particularly acknowledge our partners watching us from Metro Manila, Bulacan, Camarines Norte, and South Cotabato, and of course, everyone who are already joining us from the Zoom and Facebook page. Okay, Band Toxics is an independent, non-government environmental organization that works for the advancements of environmental justice, health, and sustainable development in the area of chemicals and waste, with special focus on women, children, and other marginalized sectors. We work closely with government agencies, communities, civil society at the local, national, and international levels to reduce and eliminate the use of toxic chemicals and support global sustainable development goals through education campaigns, community grassroots interventions, training and capacity building, policy research development, and advocacy programs. So, did you know April is World Autism Month? Autism is a developmental disability which causes significant social communication, medical, and behavioral challenges. Because autism is a spectrum disorder, the combination of symptoms and their level of severity vary from person to person. So why is it important to be aware of autism? Because people with autism can overcome it if they live in a friendly environment. So through this webinar, the Autism Recovery of the Philippines and Ban Toxics aims to give its participants knowledge on autism. It will feature discussions on the effects of the environment on children with autism, how to address autism medical concerns in the Philippines, using functional medicine by experts in this field. Now, to start our program, can we now call on Ms. Marilu Lagdameo Park, founder, board of director, and president of the Autism Recovery Network of the Philippines, to give her welcome remarks.
Good morning, honored guest, Dr. Angie Osmansi, a well-known doctor in the United States of America, treating children with autism. Our very own Dr. Lourdes Chanchanco, Director for Research and Innovation at Ateneo School of Medicine and Public Health, who is helping the children with special needs in Camarines Norte. Also proud to introduce the Ban Toxins Incorporated Executive Director Ray San Juan Jr., one of the ARNP partners. Our colleagues from the province of Camarines Norte who are present today, to all the officers and members of ARNP, and to all participants from the different ARN communities for children with special needs in Camarines Norte. Autism Recovery Network Advocacy, Autism Research Network, Barangay Daycare Federations of LGU Daet and Santa Elena, Barangay Nutrition Scholar of Santa Elena and Daet, Barangay Health Workers of Vinsons, Mabini College Community, the professors and the students, and those who are attending online. Good morning and welcome to the ARNP webinar on Autism Awareness Month. We are happy to announce that webinar is an extraordinary webinar since the participants are coming from different countries, the USA, Philippines, and Korea. ARNP is also partnering with Ban Toxics Incorporated to have a holistic approach in addressing the causes of autism. April is the Awareness Month, and after this webinar, all the participants shall have gained knowledge about autism, as shared by the experts and speakers present today. There is hope for our children with autism, given with the appropriate diagnosis and treatment, and the opportunity to live in a friendly environment. Are we all excited to know how children with autism can function and mainstream in the society? We are now officially opening this Autism Awareness Webinar as a part of World Autism Awareness Month. And I welcome you all. And thank you for attending this webinar. May God give us wisdom to continue to understand more the children with autism and give them the hope to be mainstream in the society, providing a friendly environment for them to feel love and care which they needed most. Thank you and God bless us all. Maraming salamat po.
Thank you very much, Miss Marilu Lagdameo Park for the short, inspiring words. Okay, without further ado, let's call on our first distinguished speaker. She is a medical board of the Autism Community in Action, or TACA, and a faculty of the Medical Academy for Pediatric Special Needs, MAPS. She is also the director of True Health Medical Center in Illinois, USA, and owner of Pure Compounding Pharmacy. She utilizes evidence-based integrative medical interventions to help those diagnosed with ADD, autism allergies, gastrointestinal issues, and related disorders for 2 decades. Moreover, she is certified in family practice and integrative and holistic medicine and homeopathy. Let's give a warm virtual applause to Dr. Anju Usman Singh.
Good morning, everybody. It's so nice to be here, and thank you, Mary Lou and your Autism Network and Band Toxics for inviting me to come speak today to all of you. I know I'm speaking to you from a different country, and my perspectives might be a little different from what you see in your countries and where you are, but there's a lot of commonality between the children that I see and the children that many of you are dealing with, or even have your own children with autism. So I'm going to talk to you today. Dr. Tippy should be actually speaking before me because she can give a really great summary and start this kind of conversation off. However, since it's late at night here, they put me first. So I'm going to share my screen and get started with my presentation. So I'm going to talk to you about this concept of pediatric toxicity, and then we're going to talk a little bit about detoxification and what that means. So I'm here to help provide you all with some educational information. Please don't take this as specific medical advice that I'm giving you. And a lot of the studies I'm going to share with you have been conducted, but there's not a lot of clinical trials on this type of information. A lot of this information has been developed over the last 30 years through a network called Defeat Autism Now, or DAN. And then now we have something called MedMaps, or Medical Academy for Pediatric Special Needs. And so there's a group of doctors that train other doctors to understand these kind of integrative approaches to children with autism. So one of the big kind of thought processes is that our kids with these developmental delays and things like autism or chronic illnesses have a hard time getting things out of their body. So you might say, well, I'm exposed to this chemical and I'm fine, or I'm exposed to lead and I'm fine. But the children who are diagnosed with these types of issues are not fine with these toxins. So the concept is garbage in and garbage out. We don't want to put the garbage in. We want to take the garbage out of the body. So there was a study by this group called Environmental Working Group, and they have a really nice website. It's called ewg.org, and they talk about all kinds of toxins. And they did a study in newborns, and what they found in newborn babies is that they had over 287, almost 300 chemicals in their body when they were born. There's a concept here called clean slate, or tabla rasa, which means that when you're born, you should be born clean, should be born pure. You shouldn't be born with pesticides and herbicides and chemicals and pollutants already in your body, because if that's the case, you're already kind of starting at a deficit. You're starting with potential things that could cause a lot of harm to your neurological system, your gastrointestinal system, your immune system. So again, I don't know the specific statistics in your country, but the new statistics that just came out in April for Autism Awareness Month is that in the United States, autism is now 1 out of every 36 children. And that's alarming. It's extremely scary. They say that it's in 1 in 24 boys. And so boys make up a ratio of 4 to 1 over girls. But it's not just autism. We're seeing epidemics of. When I was in medical school, the rate of autism was 1 in 10,000. And now it's 1 in 36. So what do you all think is causing this exponential rise? Now, we know there's no such thing as a genetic epidemic. So we think that these epidemics have something to do with the environment. So autism, ADD, anxiety, juvenile diabetes, childhood cancers, asthma, and the neurodevelopmental delays and disabilities in general is 1 out of 6. That is just extremely alarming. So 1 in 6 children have a mental, behavioral, or developmental disorder, which is it's really sad. It's really sad. At the University of California, Davis, there's a researcher, and she says that these rates of autism cannot be explained by how well we diagnose. It cannot be explained by genetics. The explanation has to be some type of chemical or potential infectious cause. And, we're leaning more and more towards, infections do play a role in our patient population, but the toxins play a very big role in affecting the immune system so that our children just don't handle the infections very well. So our Center for Disease Control, called the CDC, says the epidemics of cardiovascular disease, immunological disease, neurological disease is likely associated with environmental toxins. That's coming from our own Center for Disease Control in the United States. So why are we talking about children? They don't complain. They don't say, oh, I have a headache. Oh, I don't feel good. Children are very resilient, but they're extremely vulnerable. So children are far more susceptible to the damage from these types of chemicals than adults. And it's ideal if parents who are planning on having children, so the pre-pregnancy planning for mothers and fathers to have a healthy child would be that the mothers start to take care of their body to avoid exposures to these chemicals. And we call these chemicals endocrine disrupting chemicals. The word endocrine means hormones. And so these chemicals really affect the hormone system in particular. So as I mentioned, children are at very high risk, but even greater is an unborn child or the fetus. So the fetus in the womb is at a very big risk if exposed to these types of chemicals. So the placenta does not filter chemicals. So if the mom gets exposed to chemicals, it goes to the baby. Also, the fetus has an immature liver. So if there is exposure to a chemical, the fetus can't get rid of it. It stays in that fetus. And so there's no ability to get rid of it. There's no ability for that garbage to go out. And then the baby is growing and the organ systems are developing. And again, if they get hit early on in utero, they do not develop efficiently or normally. So children themselves have an increased risk of exposure to toxins. One of the risks is that they're crawling on the ground. They're putting things in their mouth and they're small. And so they have a big, if you get a burden of chemicals in a small space, then that burden is greater. We're more dilute in a sense. So They have greater skin surface area to weight, so the risk of exposure even from the skin. So I tell my patients, don't put anything on the child's skin unless it comes from God. That's the term I use. So if you can pronounce it and it's natural, you can put it on the skin, put it in the body, let them breathe it. But if it's not, we want to avoid these exposures. And so again, if we get exposed early on in life in utero, as in early childhood, then we have a whole lifetime to kind of accumulate more and more and more. And so it's this accumulative burden that gets kind of stuck in the body. One of the big things we tend to worry about, and we're using the term toxin very loosely. We haven't defined what all these toxins are. There's a lot of them, but one of the big ones is acetaminophen. I don't know what the procedure in your country is for when we go to the doctor and we get a vaccine, but here in the United States, when children go to the doctor and they get an illness or they get a vaccine, the doctor says, please take Tylenol or acetaminophen for the pain. But acetaminophen, there's lots of studies on acetaminophen and the risk for autism and also ADHD, which is attention deficit hyperactivity disorder. The concept of these chemicals causing sexual dimorphism, which means that they bend the gender of the children. So girls become more masculine and boys become more feminine. And this can be caused by some of these chemicals such as PCBs and dioxins and pesticides and herbicides as well. And then there's heavy metals and their role in autism spectrum disorder. And things like lead, aluminum, mercury, arsenic have been studied at length and have an effect on a developing brain, on a developing nervous system, and play a role in susceptibility to things like autism. So they did this Healthy Child project at Mount Sinai Hospital in New York, and they came up with a list of the chemicals that they thought were the most threatening to children, the most likely to cause harm to the brain and cause harm in brain development. And the top chemicals were things like lead, mercury, air pollutants from coal-fired power plants and fuel combustion, PCBs, PBDEs, which are flame retardants, manganese, arsenic, pesticides, various solvents like benzene, toluene, acetone, TCE, things in nail polish, glues, varnishes, bisphenol A or BPA, food additives like dyes and preservatives in the food, and even fluoride was on their list. Here in our country, they put fluoride in our water supply as a way to prevent tooth decay, but it has some concerning effects on neurodevelopment. So what do these toxins do? I mentioned that they can disrupt the hormone system or what we call the endocrine system. But how do they do that? Even at very low doses, parts per trillion, and 20 years ago, we couldn't even measure parts per trillion. They're so minute that there's really no safe levels of this. So even low doses of these chemicals can be harmful. These chemicals are very difficult to detoxify. They're called persistent organic pollutants. And the reason they're called persistent is they stay persistent in the body. They are oftentimes fat soluble. So that means that they get stored in the body, in the nervous system, in fat like the liver, in the myelin, and they're very difficult to detoxify. They can even damage the DNA. So if the DNA is damaged, then when that person has a child, that passes on that damage. So that damage can be inherited. These chemicals alter brain structure, brain chemistry, they alter behavior, they alter mood, they alter hormones, they alter reproduction. They can lead to things like cancer in the breast and in the prostate. They can lead to insulin resistance and obesity, and it's a huge problem with girls with having something called polycystic ovarian syndrome, high insulin resistance, diabetes, and high testosterone. They lead to interference with thyroid function. They disrupt something called mitochondrial function, and mitochondria are kind of our energy producers in the body. So if you can't make energy, you can't run metabolic functions. These toxins cause oxidative stress, which is damaging to our cells and our RNA and our DNA. So this is a list of some of the big endocrine disruptors. I mentioned a few that were on the Mount Sinai list. I also wanted to mention things like Teflon coating, which is the coating on nonstick pans, is extremely toxic as well. Flame retardants in clothes that are new clothes, new furniture, new cars, they are sprayed with things like flame retardants. Perchlorate is in dry cleaning. Some of the, if you take your clothes someplace to get clean, sometimes they'll use perchlorate to clean those clothes. Parabens, we see a lot in makeup. So make sure your makeup, your lipstick does not have parabens in it. So as I mentioned, these toxins cause a lot of damage. I mentioned immune dysfunction. In specific, for our patients with autism, it can affect adrenal glands. Adrenal glands are those glands that sit on top of your kidneys, and they make hormones and they make cortisol, and they help us deal with stress. And when they did studies on where toxins accumulate, when you think about a little baby and where those fat-soluble toxins are going to go, where is the fat in a baby? Well, the fat is in the brain. 70% of the brain is fat. The fat is in the liver. And the other place that they found a lot of the toxins was in the adrenal glands. And that's our stress handling place. Thyroid is another place that these toxins can accumulate. So there's a lot of issues that occur because of the this toxin load. One of the other big things that the toxins can do is affect the gut. So there's a doctor by the name of Dr. Bowie. He's out of a university called Harvard, and it's a famous university. And he wrote a paper on how this disruption or imbalance in the microbiome or in the gut can lead to something like autism. And his theory was that when this microbiome or gut bacteria gets disrupted, it sets the stage for leaky gut. It sets the stage for immune dysregulation, and it sets the stage for an abnormal gut-brain connection. And so some of the factors of this disruption in the gut microbiome are things like moms who have autoimmune conditions, moms who have had a virus infection or a fever during their pregnancy, babies who are small when they're born or at risk, babies who have had a C-section versus a vaginal delivery, babies who are formula fed versus breastfed, the child's diet. Early antibiotic exposure is detrimental to this gut microbiome, and then early food sensitivities and allergies. In his paper, he doesn't talk about chemicals and toxins, and that's what we're kind of focusing on today. But I would add that to the list of factors that disrupt the microbiome. And then stress can as well. One of the big chemicals that we talk about is a chemical here that's called Roundup. People have really pretty lawns and they don't want to see any weeds in their lawn. So they go around spraying with a chemical called Roundup, which is glyphosate. And glyphosate is extremely toxic to the gut and the nervous system. So when the gut flora gets altered, This leads to issues with the absorption of B vitamins. It leads to issues with absorption of nutrition. The gut also helps to destroy toxins. So if the gut isn't working the right way, if if there's an imbalance in the bacteria in the gut, then we can't get rid of toxins efficiently. The microbiome also helps with hormone regulation and blood sugar regulation. But one of the most important things that our biome does in the gut is it helps with our immune system. 70% of our immune cells are in the gut. And we think of autism as a neuroimmune inflammatory condition. And a lot of that inflammation and abnormalities in the immune system come from this imbalance in the gut microbiome, which can also lead to inflammatory bowel disease, allergies, and what we call dysautonomia, where the vagus nerve and the neurotransmitter of the vagus nerve called acetylcholine doesn't work efficiently. Now, the doctor who wrote this study, Dr. Dietz, has a book, and it's all about this particular enzyme called methionine synthase. And this enzyme is very important for attention. It's also important for language and speech. Now, that enzyme can get destroyed from working with toxins. And in his paper and in his book, he talks about the toxins that affect this enzyme called methionine synthase. And he mentions things like copper, lead, mercury, aluminum, and he also talks about alcohol. And that would be alcohol use in the pregnant mother. So this enzyme is really important for something called redox. Redox is our ability to reduce or prevent oxidative stress. And when redox is not working, then we have a lot of oxidation, and that leads to a lot of inflammation. So I think you guys are trying to get my point. And I know there's not, maybe the science is a little technical, but if you see it, it makes sense. This enzyme that Dr. Dietz talks about, methionine synthase, is right here in this pathway. And this big pathway here is called your methylation pathway. And that downstream makes something called GSH, and that's glutathione. And that's really important because glutathione is our garbage out. Glutathione is the thing that we need to get rid of toxins. So you can see that if your methionine synthase is blocked and not working very well, then you're not going to make glutathione, and then you'll have even more difficulty getting rid of these chemicals and these metals. You'll also notice that where methionine synthase sits is B12. And B12 is one of our biggest interventions that help our patients with autism, with language, with speech, with attention. So Jill James did this study, and she found out that children with autism had low methionine, low homocysteine, low cysteine, and low glutathione. So she said that they didn't have a great methylation pathway, that they don't make glutathione, so they don't detoxify very well. So what she did was she worked on this folate cycle that's next to this methylation cycle, and she gave them folinic acid, she gave them B12, and she gave them something called TMG. And when she gave children with autism these three substances, this particular pathway became normal. And so she's very famous for doing this type of research and showing that some of these supplements can then help reverse the problem with detoxification that our children have. There's a doctor by the name of Dr. Newbrander, and he's researched thousands and thousands of children using methyl B12 injections. And he found that it helped them with cognition, thinking, attention, focus. And so It's, again, one of a key protocols that we have, and that's, again, involved in this methylation pathway. So as I said before, when we don't make enough glutathione, we can't get rid of chemicals, we can't get rid of toxins. But what glutathione does is it's an antioxidant. Now you might ask, what's an antioxidant? So an antioxidant is something that is donating an electron. And those of you who are into physics, everything is positive and negative. And a pro-oxidant is looking for an electron. And in the process of looking for an electron, this pro-oxidant damages things. It causes damage to our cells. And the long-term effect of that is aging. As we age, we become more oxidized, and our bodies kind of slowly rust or deteriorate. But we don't want that to be happening to young children or young adults. We don't want them to have a lot of oxidative stress. And so we need these antioxidants. And so many of you know foods that are high in antioxidants like noni, goji, blueberries, cranberries. So these pro-oxidants are extremely damaging. So these chemicals, these metals are oxidizing. They also destroy things like the mitochondria, as I mentioned, and that leads to even more oxidation. The mitochondria make energy for our cells, and the mitochondria utilize a lot of antioxidants to stay healthy. Now you might say, well, what happens if I don't have mitochondria working very well? Well, mitochondria run a lot of metabolic pathways. We can't utilize our fats, our carbs, our protein to make energy efficiently. We can't make energy. We can't build muscle. We can't build tone. We have low tone. We have fine motor delays. We have gross motor delays. We can't move our eye muscles. And so the mitochondria are really important. And we find that children with autism oftentimes have mitochondrial dysfunction. And so it's an important piece to what's going on with them. One of the big issues with metals is that they cause more of this oxidative stress. So children with autism already have an inherent issue with making glutathione and their methylation pathways. And then if we throw things in that inhibit methionine synthase like lead, it's going to make things worse. So there's a ton of studies on how even small levels of lead. So if you're worried about lead and you go to your doctor and you get a blood test and say, oh, your lead level is normal. What does that mean? What is a normal lead level? So I'm going to kind of skip this slide. I had a slide in here that I thought was here, but anyway, what is a normal lead level, and what would we call lead toxicity versus a lead burden? So when I was in medical school, the lead level had to be around 60 or 60 to be considered toxic. Then the lead level was considered toxic at 40. Then it was considered toxic at 20, then 10, and then now 5. So here, if your lead level is above 5, then the Board of Health comes and checks your house to see if you have lead in your house or if there's lead in the water supply. Before, they wouldn't even bother till it was 60. So, why is this toxicity level changing? I think some of it is because our burdens are increasing. So it's not just lead we're dealing with, or mercury, or cadmium, or arsenic. It's pesticides and herbicides and glyphosate and PCBs. I mean, accumulating all of these. They're not additive. 1 + 1 does not equal 2 in this case. 1 + 1 equals 100 or 1,000. So these toxins are synergistic. They're additive. Again, if we get exposed to them in critical periods in our development, they're even more toxic to our nervous system and our immune system. And then some of us, like our children with autism, have this inefficiency to detoxify this very well. So they accumulate these toxins, and over time, accumulate them more and more. I like to show this graph because people think of lead and they think of IQ, intelligence. And one of the big things that lead does is it decreases intelligence, or IQ. Now, remember I said that the lead level at 50 was considered toxic, and that if you had a lead level, say, of 20, it would drop your IQ by 10 points. So you would take an IQ of 100, which is pretty good, to 90, which isn't that great. But where does the most drop of the IQ occur? The biggest drop in the intelligence actually occurs between 0 and 1. By 0 and 1, you can drop the IQ by 7.8, 8 points. Now, a kid with developmental delays and a kid with issues like this, that's a big difference. So now the thought is there's no safe level of lead. And the guidelines now for diagnosing toxicity in the US is if it's greater than 5. And they don't recommend something called chelation unless it's greater than 25. But we just saw how low level lead exposure can cause oxidative stress. It can cause inflammation. It can lead to decreasing IQ, even at a level of 1. So what we use is what we call the precautionary principle, which means that, when we're dealt with all these kinds of issues that could be harmful to human health, we should be precautionary, especially when it comes to our children. So when we're talking about autism, we have a spectrum. And so we want to take into account things like genetic predisposition, things like toxins from our air, water, food, chemicals, mold toxins, heavy metals, even electromagnetics can affect our bodies. And then this effect on the immune system, that maybe we got an infection or an allergen or some other immunological hit on top of a major stressor. And we put all this together, the genes, the toxins, and other stressors, infections, allergens, and what happens, timing during a critical period in development, and we end up with things like oxidative stress, mitochondrial dysfunction, gut issues, hormone issues, and impaired detoxification. And that all leads to something like chronic neuroinflammation. So I mentioned some of the chemicals that we're concerned about, the metals, but there's also mold toxins. Mold toxins are called mycotoxins, and there are quite a few different mold toxins that are very detrimental to our patient population, like ochratoxin and gliotoxin. So when we're dealing with patients, we want to get a good history. What's the exposure? What's mom's exposure? Did she have a C-section? Did she have amalgam fillings that have mercury in them? Did she eat a lot of fish that could be contaminated with mercury? What was the father's exposure to chemicals and metals? What's the infant's exposure? Was the infant breastfed or formula fed? Was there a regression in behavior? And I like to get that history of regression, because the regression tells you about what tipped the scale. Usually we'll see kind of normal development, normal development, normal development. And then something happened that kind of pushed the system over the edge, like the straw that broke the camel's back. And what was that trigger? Was it a toxin, infection, allergen, other stressors? So again, what's going on? Seizures are another big one that we see a lot of too. Look at the physical exam: swollen lymph nodes, pale skin, poor muscle development, dark lines on the teeth that make you think about lead, dark circles under the eyes, what makes you think about allergies, the obesity. Gynecomastia is breast development in boys, excessive hair growth in women and girls, undescended testicles. Another big one is midline defects, cleft palate, cleft lip. Those are associated with folic acid issues. And I showed you how that folic acid cycle really sits next to that methylation cycle. So when we have issues with methylation, we have issues with folate as well. And in pregnancy, if the mom doesn't get enough of this good forms of folic acid, then we can have these midline defects in the baby, the tongue tie or the hypospadias. Here I have the luxury of doing lots of tests. I can do blood tests to look at metals, molds, chemicals. I can do urine tests to look at these things, hair tests, stool tests, all kinds of tests. I can do genetic tests to see where the blocks are in the detoxification pathways. There's some clues, check a lead level, check an aluminum level, look at the thyroid function, look at testosterone, estrogen, look at mitochondrial function, check for mycotoxins or oxalates, look at allergy testing, food sensitivity, look at the liver. So again, I showed you this pathway. This is your methylation pathway. It makes glutathione. The pathway next to it is our folate pathway, and that's all the midline stuff. But folate also helps make our neurotransmitters. Remember, our neurotransmitters help us with our mood, serotonin happy, dopamine attention. So again, if these pathways are blocked by metals, then this system doesn't work, or chemicals, the system doesn't work efficiently. And then we can't clear ammonia from the body. So methionine or methylation makes cysteine, cysteine makes glutathione, but it also makes some other nutrients that are really important for detox, like sulfate, coenzyme A, metallothionein, taurine. These are all really important for detoxification. So again, if the system isn't working well, we can't get rid of stuff. We can't get rid of that garbage. And Amy Holmes showed in her paper where she looked at hair. She found that children with autism, when you look at their hair compared to typical children, they didn't have a lot of metals coming out in the hair. Well, why is that? Why didn't they have a lot of metals or mercury coming out in the hair after being exposed? Because the theory is that they weren't excreting it. So here's a way of figuring out what's coming out of the body. And that's the thing with these toxins. We don't have a good test for what's in the body. We can only measure hair, urine, stool, blood. That's all stuff that's coming out, but we don't know what's in the brain. We don't know what's in the body. So we have a high degree of suspicion. This is a test I did on one of my patients, and this is a excretion of lead after I gave this particular patient something called calcium EDTA. But this patient was taking another medicine for 1 year to clear the body of mercury. So the mercury levels looked pretty good, but what was still sitting there was a whole bunch of lead. And as I mentioned, lead decreases IQ, lead causes constipation, lead causes cognitive delays and speech delays. So, I mean, it's a big problem. Here's just an example of a urine test showing that, again, we can measure these toxins from mold called mycotoxins. And then we can measure chemicals in the urine as well. And so we have this strategy. What do we want to do? We want to create movement. We want to enjoy sunlight. We want to establish what I call a sleeping sanctuary. We want to try to avoid a lot of electronics in the bedroom when our children are sleeping. We want to clean up the environment. So we want them to have good air quality. We want good water quality. We want to avoid chemicals in their environment. We want to work on their diet, clean food. We want to work on their gut. We want to support healthy nutrition. We want to try to get rid of some of these toxins. So how do we get rid of them? We get rid of them through the lymphatic system, through our skin, through our kidneys, through our liver. So we want to support those pathways. We want to support the pathways of methylation and sulfation and glutathione. We might want to give them a medicine to pull out the metals, like I did in that particular child with calcium EETA. And we might want to work on mold, depending on the history. So here are the strategies. Clean up the environment, soaps, shampoos, cleaning agents. We don't want to use ceramic cutlery or ceramic cups, because the ceramics are oftentimes painted, and that paint comes from lead. We want to use stainless steel or cast iron for cooking. We don't want to use Teflon or aluminum rice cookers. We want to try to wear cotton clothes, avoid fluoride toothpaste, put an air purifier if possible in the bedroom, avoid the amalgams in the teeth. You can use ceramics for the teeth. Avoid care products, personal care products that contain perfumes or fragrances. Avoid the use of plastic, especially plastic water bottles that are smushy. Avoid BPAs. Avoid new furniture. Take the food out of packaging as soon as you get it. You don't want to store it in plastic. You want to store food in glass. Use sunscreens, but try to use things on your skin that are organic and natural. Avoid aluminum baking powder, aluminum salt, aluminum foil, those kind of aluminum squishy things that children are eating out of nowadays with the baby food. Avoid that. Avoid aluminum lined juice boxes. Don't spray your child with pesticide or mosquito repellents containing DEET or strong chemicals. Use natural shampoos and soaps. Don't kiss your baby if you put on a toxic lead containing lipstick that's super red. The red is from cadmium oftentimes. Wash your new clothes before you wear them. Outgas any furniture before bringing it into your home. Try to use natural fibers and natural materials. Avoid electrosmog, especially in the bedroom. Shut off your router at night. Put your phones in airplane mode when you sleep. Those are some ideas. We want our water quality to be good. So think of using a carbon filter or some type of filter to filter the water to get rid of chemicals and VOCs and fluorides and metals. Think of using some type of filtration for your air, HEPA filters, especially if you have allergies or sinus type issues, to just kind of clean up the air. HEPA filters are a good type of filter to use, and there's other types of filters as well. Food is really important. We want to go back to our basics of cooking, use less packaged foods, use less foods with preservatives and dyes, as we mentioned. So we want to eat fresh, locally grown food that's organic, GMO free. We want to incorporate a lot of spices and herbs because these have something called polyphenols, and the polyphenols help our gut microbiome that is so important. We want to look at the Dirty Dozen. The Dirty Dozen are the foods that are the most toxic with chemicals. And you can find that list of the Dirty Dozen on that environmental working group website that I gave you. We want to eat hormone-free meat and animal products. Animals are often injected with hormones like estrogen and antibiotics. We don't want to be eating that stuff. We don't want our boys to be eating that stuff in particular. We don't want our girls to be eating that stuff. We want to use good fats, omega-3s, 6s, and 9s. These chemicals and toxins sit in the fat, and so I call it an oil change. Put the good fats in, and it helps clear the bad fats that are oxidized. Use clean cookware, utensils for storage, and drinking. So I call that back to basics. But in our children with autism, we often recommend a dairy-free, gluten-free, soy-free diet. There's various reasons for that. I won't get into all of that. but these foods tend to be very inflammatory. They're very hard to digest. They're high in something called glutamate, so they cause a lot of excitation in the brain. So we don't want to add to that. So we highly recommend a dairy-free, gluten-free, soy-free diet. We also don't recommend a lot of carbohydrates and sugars or processed or refined carbohydrates. That's like the white foods, more of the brown rice, the brown grains. We want to use more antioxidants in the diet. So that's fresh fruits and vegetables. We want to avoid something called excitotoxins. Excitotoxins create more excitation in the brain. Things like MSG, NutraSweet, red and yellow food dyes, nitrites, sulfites, high fructose corn syrup, and caffeine. Try not to microwave, especially in plastic. Don't store food in plastic. Try to use things like avocado, olive oil, coconut oil, flax oil. These are good fats to try to use as well. And see if you can add some fermented foods to the diet. Fermented cabbage and fermented vegetables are, again, good for that gut microbiome. If we're dealing with mold toxins, sometimes we'll use something called a binder. Binders will bind some of these chemicals. There's different binders for different types of chemicals. Some chemicals like metals are cations. They have a positive charge. So you need an anionic binder to get rid of those. Some chemicals have a negative charge. So then you need a cationic binder to bind that. So there's different kinds of binders for different types of things. But in general, things like charcoal, clay, chlorophyll, are good binders. There's even binders that are pharmaceuticals like cholestyramine. So again, the different toxins might need a different nutrient. So for instance, if we're dealing with things like lead, if we give calcium and magnesium, that goes in and the lead kind of comes out. If we have a problem with cadmium, we put zinc in and it helps the cadmium to be released. If we have a problem with PCBs and these chemicals, putting those good fats in, like omega-3s, are very helpful. If we have a problem with radiation or radioactive substances that are affecting our thyroid, then we can use iodine or iodide. If we have a problem with mercury, selenium can be very helpful. And you can just even eat one Brazil nut a day to increase your glutathione levels. So again, using minerals is very helpful for this detox strategy. Getting antioxidants, especially vitamin C and vitamin D, getting the good fats, omega-3s from fish and flax, getting eggs that have choline that helps with methylation. So these are really helpful kinds of things. Citrus pectin is a good binder, and even yucca. Yucca is a very good binder for some of these toxins. Eating foods like plantains or undercooked rice or undercooked bananas or unripe bananas can also be very helpful for the gut. We want to get rid of some of these toxins. And so how do we get rid of them? We get rid of them through the skin or the lymphatics. You can do something called body brushing. Just gently brush the body from the toes to the heart, from the fingers to the heart with a gentle brush. That helps to kind of stimulate the circulation. Trampolining can also be helpful for detoxifying the skin, and just sweating. Sweating is really good, or using a sauna to sweat. We want to keep the kidneys flushing, and to keep the kidneys moving, we need a lot of minerals, especially things that are alkaline. So things like lemon in water, lime in water, apple cider vinegar, and honey in water help to flush the kidneys. Cranberry juice, green matcha, green tea, and then even just baking soda in water, electrolyte water, things like Epsom salts baths, which are magnesium sulfate, and certain herbs like burdock, horsetail grass, dandelion are good for kidneys. As I mentioned, we really want to support that methylation and those detox pathways that go through the liver. We sometimes give things like methyl B12 We give things like methylfolate, folinic acid. We work on sulfation with B vitamins and a nutrient called molybdenum. We sometimes give glutathione for detox. And then we work on the liver to kind of get the body to clear things out of the bile using very bitter herbs, like mint is a good way to do that. Fenugreek, milk thistle, and broccoli sprouts are great for the liver. There's even supplements that have all of these types of things in them, but you can even just use local herbs for this. So again, in summary, we want to have that concept of getting rid of that things that are the garbage that's going in and helping the toxins to leave. So that's eliminate what harms and add what heals so the toxins can leave. Cleaning up the environment, cleaning up the diet, cleaning up the gut, getting in some good nutrition, antioxidants and minerals and good fats, working on our body's detox pathways, methylation, sulfation, glutathione, working on these channels of elimination, liver, lymph, and kidneys in particular. And all of this put together relieves oxidative stress, improves inflammation, improves the gut-brain connection, improves immune dysfunction, and in many of our patients improves their autism in the long run. So thank you so much for listening. And I'm happy to answer a couple questions if you have any. And if you need to reach me, I'm at True Health Medical Center here in Chicago, Illinois. So thank you very much.
Thank you very much, Dr. Anju, for that
Yeah.
very informative presentation. Let's now open the floor for questions from our participants here and in the Zoom.
So if anybody has any questions, anything
Yeah,
that you can think of, I'm happy to answer it. You can just put it here in the Q&A box, or if you can't find the Q&A box, you can just put it in the chat and I'm happy to answer any questions. Or if you have your questions later, you can get a hold of this group and email them to me and I'm happy to answer your questions.
okay. Yeah, I think we have a question from Dr. TP. Yes, ma'am.
Hi, Dr. Andrew. Is
Hi,
it
Dr.
okay if I
Tiffany.
ask the first question?
I would love it. Thank you.
Okay, so you actually gave us, thank you very much for that lecture. We learned a lot from everything that you talked about. My question is, oftentimes we feel that not all of like the labs and the supplementation are available here locally. And you gave us a lot of steps for detoxification. Would you recommend a process? Like, where do we start? Is there like, we have to start here before we proceed with certain things? Can you enlighten us on that?
Yeah, and so that's why I had my steps at the end. I always say, like, clean up the environment. You don't want to put more stuff in. So that's easy to kind of avoid. That's number one. And getting movement, getting sunshine, getting that vitamin D. That's pretty simple. Drinking clean air, drinking clean water, trying to breathe clean air. I think cleaning up the environment is a process though, because it's very difficult. Like, I go to the store every day and I know I'm getting things that I really don't want in my food. And I know I'm breathing things I don't want to breathe, or I have packaged, products I don't want. So, that's a process. And then the second step, I think the number one step, no supplements involved, is cleaning up the diet. I would say if I had to pick the number one thing that helps my patients the most is a healthy, clean, organic, as much as possible diet, and doing the dairy-free and gluten-free and sugar-free diet. And it's probably the hardest thing for most of the families to do because we're so ingrained in our eating habits.
We are.
But think about how our grandmothers ate or our grandfathers ate.
Right. Thank you, Dr. Andrew. Actually, it's kind of easy for us because rice is our staple. So
Yeah.
it's very accessible. It's gluten free if you if like some of our audience would consider that. Thank you,
Yeah,
Dr.
same with my Indian families. It's easy because they do a lot with vegetables. They do a lot with like gluten-free things. And then cleaning up the gut, using fermented foods, prebiotics, probiotics, high fiber stuff. You know, those things are very simple, and incorporating herbs and spices and local herbs that can help support these detox pathways.
Okay. Thank you.
You're welcome.
Thank you, Dr. TP. We have other questions from our participants. Yeah, let's acknowledge Sir Roniel. Sir Ronel, do you have a question?
I couldn't find any questions in the Q&A, so.
Yeah. Sir Ronel, do you have a question? Miss Clarita? Okay. Think not. Let's call on.
Maybe they forgot to unmute their.
Yeah. Miss Ella, do you have a question? Yes, Sir Ronel. Okay. In case you can unmute, you can also post your questions at the chat box, and Dr. Andrew would be happy to answer your questions.
Question.
I have a question here. It says, are injectable glutathione are as effective too as an antioxidant? I've had experience using glutathione creams, liposomal glutathione, like an oral supplement. I've used glutathione suppositories, and I've even used IV glutathione. And yes, it does help with oxidation and oxidative stress, but the goal is for the body to make it. So again, the lead and the aluminum is blocking the production of the glutathione or other toxins. So we want to get rid of those, and then we want to work on our methylation pathways, and that will help the body to make glutathione, like in Jill James' study. So I think it's okay to take glutathione, but having the body to make it is even better.
Thank you, Dr. Andrew, for the answer. I think we have another question. Sir Ray?
Good morning and good evening on your side, Dr. Singh. Well, I'm really so much impressed with the presentation, and I was so shocked with the exponential increase of the number of ASD or the autism from the past years. As you mentioned, during the time that you're studying, it's 1 in every 10,000, and now it's 1 in every 36 children that's being born in your place. And I'm so much alarmed with this figure, because I have no idea how other countries are aware of these issues that we are facing, especially that environment is really one of the culprit of this autism. So my question is this: thank you for not simply giving us the chemicals and the hazardous chemicals that affects the environment and the body and the pregnancy, and also for giving us the other possible means and ways to avoid and to cleanse the body, especially here at the office. We're talking about what if the family is planning to have another child, then what preparation are we have to take in order to have at least a healthy childbirth after taking this consideration of eating habits and environments and avoiding some chemicals. And the question, Dr. Singh, is that some of the third world countries are very much exposed to these chemicals, the lead, the mercury, and other things with their work, and the diesel fumes around us because of the traffics. So my question is this: besides those things that you mentioned, how long should a couple prepare themselves if they want to have another child, or if they want to have a child for a new couple? How long they should prepare themselves, both the mother and the father? Of course, the mother is very important, but of course, the father is also needs to have a good preparation with the wife. So, how long is safe enough in order to plan for have another pregnancy or to have another child?
You know, I don't even know if they've even studied that yet in terms of like how long is enough of a time to really clean up your body. I've had to deal with some mothers, and a couple of things that we've had to deal with is, you know, now I want to get pregnant. What shall I do? And, you know, again, it's the same kind of concept, trying to avoid the toxicity, trying to clean up the diet, trying to work on their gut. And then taking a few things that we found that are really important for planning pregnancy, things like omega-3s and zinc, and this folate and B12. They're very important. How long does it take? I don't know. I do tell people that, you know, exercise, sweat, try to do some type of detoxification, get your body cleaned up a little bit, but don't do that while you're pregnant. Because I had a doctor the other day who was giving one of my patients glutathione while they were pregnant. And I said, don't do that. Because you don't want to detox while you're pregnant, because the toxins will go into the placenta.
Oh my God, yeah.
So you just want to just not really stir the water when you're pregnant. But, you know, I would say, you know, they should start thinking about this a year in advance. And I did write an article for the Autism File on pre-pregnancy planning. And I can share that article with you all if you're interested in the article. But it's a step-by-step on like, do this, pre, during, and post. Yeah, for prevention.
Yeah, please do share with us. Do share. These informations will be very helpful for us. Not for me because I'm already old, but for the listeners of this webinar.
I think, you know, if our children are affected, their genetics predispose them to this problem with detoxification. We have the same problem, us parents. We just didn't get hit early on. So we don't want to develop Alzheimer's or dementia or autoimmune diseases. So we have to take care of ourselves. So when I tell my patients, you know, it's a whole family is going to do this. The whole family is going to do the diet. The whole family is going to detox. It's going to be a community affair.
Yeah, it's the mindset of everyone that matters. Yeah. And another thing, maybe last question, is that one of the common exposure that we have here in the Philippines, especially near Metro Manila, is the exposure to the fireworks and the manufacturing of these fireworks, especially in the province of Bulacan. So, is there any study that can correlate the fireworks exposure and autism? Because I'm trying to research on that also.
I know there's studies on firework exposure and, toxicity and medical issues. I don't know if they're specific with autism, but I would expect with the issues with children with autism and their detoxification that the chemicals from the fireworks are quite harmful.
Yeah.
And they're very harmful to children, more so than adults, as we discussed, because children are more vulnerable.
Yeah.
So in those cases, when it's those types of chemicals, the way to kind of clean up the body is you use different things like the clays or the charcoals or chlorella to kind of bind those types of negatively charged chemicals.
Okay. Thank you.
Thank
You're
you,
welcome.
Dr. Andrew. For our last question, we have a question from Miss Virginia Agcopra. She is asking, bottled water is so popular and frequently used. How are we going to choose the most safe bottled water? What marks should we search for in the bottle? Is this safe for infants, toddlers, for their bottled milk, daily water intake? Thank you.
Yeah, it's, most of my patients, I tell them not even to buy bottled water, just to buy tap water and to get a filter and filter it yourself. Again, I don't know how feasible that is in the water quality that you have there. If there's water in glass, that would be better than any kind of plastic. If you're using a plastic, then you want to use a plastic that's a hard plastic. That's a firm, hard plastic, not one that you can
Mountain.
kind of squish or crush. The plastics, those types of plastics outgas the chemicals like antimony and other chemicals that they have in the plastics into the water easier than the hard, sturdy plastics. But in general, I tell people, just get a very good filter, filter your own water, and then drink out of a stainless steel or glass type container.
So thank you, Dr. Andrew, for all the information you have given us. Thank you also for the participants who asked their question. So at this point, we'll now shift to our second speaker. So thank you very much, Dr. Andrew, for your time and for sharing your passion and expertise with regards to autism.
Thank you.
Okay, so for our next distinguished speaker, she is a licensed developmental pediatric doctor, as well as a practicing functional medicine doctor. She also works at the Ateneo School of Medicine and Public Health and Medical City. Let's give a warm virtual applause to Dr. Lourdes Sumpalco Tanchanco, or Dr. TP.
Hi, good morning, everyone. Thank you for the invitation. Thank you, Dr. Andrew, for that wonderful lecture earlier. Let me just share my screen. Yeah. Can you see my screen?
Yes, ma'am.
Okay. Sige po. So, I'll be speaking in English and may halo pong Tagalog. But this is a very special topic and that I'm interested in, and I would like to share this with all of you. I know we have some students. I was looking at the chat box from different colleges. Marami po nasa special ed. So thank you for your special interest in the field. So I'm going to talk about functional and integrative medicine approach to autism. It's actually a more basic lecture than what Dr. Andrew presented earlier, but hopefully this will get your interests and get you more engaged in the field, no? So I just have 3 simple objectives for this lecture. The first is to describe autism. So balikan po natin, ano ba ang autism, know its core symptoms, and I'd like to bring forth comorbidities that you usually see in autism. And then second is to appreciate the functional and integrative medicine approach in addressing biomedical conditions associated with autism, because I see a lot of us here are into education or maybe therapy, but there are still other modalities that we can explore. And then lastly, and I think this is the whole purpose of this lecture, this session this morning, is to foster hope among parents, caregivers, all of us who are involved in the care of these children. So let me begin by sharing about what autism is. So review lang po to for a lot of you. It's a broad range of neurobehavioral conditions. So we have to stress that although there are behaviors that we see, there's a biological, a neurologic basis for the behaviors and the clinical symptoms that we observe in children with autism. I added this as I was listening to Dr. Andrew earlier. We have to remember that it's also neuroinflammatory in nature. So inflammation happens in the whole body. So it's a whole body condition. So it's not just neurological, it's not just in the brain, it's in the gut, it's in the whole system of children and individuals affected by autism. And this is why our approach needs to approach all of those organ systems that are involved. Usually, it presents when the child is very young. In the country, we diagnose a little bit late. So a lot of our kids are diagnosed when they're 4 or 5 years old already. But if you look at newer literature, as early as 1, you begin to see symptoms already, especially among those who are siblings of children who were previously diagnosed to have autism. This is a shocking fact that was just recently released, and Dr. Andrew referenced this earlier, that in the 2023, the new CDC data reported 1 in 36. So imagine you po, if you're teaching a class of 40 students in our public schools, 40 or 60 in a classroom, di po ba? And you will have at least 1 in that classroom. That is significant. And if we don't do anything about it, who will take care of these children when they're older, especially those who have moderate or severe symptoms, diba? And that's, well, the thing that we want to bring forth in this conference is that you can do something about it. Parents, caregivers, teachers can do something about it. It takes a community to address this issue. Tignan niyo po yung increase since 2000, that's a 317% increase in the prevalence of autism, and that's really significant. This is what we do when we diagnose a child with autism. So it's a clinical diagnosis still. We don't have labs that will confirm that, okay, this is autism if a child presents to us. We need to do, as clinicians, when you go to us in the clinic, what we do is review the history of the children. We take antecedents. So we review the family history. We want to see exposures, the things that Dr. Andrew mentioned earlier. We try to go through that. We look for triggers. Like if, let's say, we see regression, is there a history of seizure? Is there hospitalization that happened right before? What were other symptoms that this child experienced? Was there a history of fall, hitting of the head? Was there a history of travel? So we want to look into those. We want to look into mediators as well. Is the dad, and I've seen this in a lot of families, does the dad smoke in the household? Where do they live? Do they live in an old house? Was the house recently repaired or renovated? Is there like, since we have rainy season all throughout the year, is there like water patches in the ceiling or in the roof? So you want to gather all of these information because they give you hints. So as parents, as caregivers, we look for the hints, we act like detectives to see what are possible factors affecting these children. This is how we diagnose it. This is how developmental pediatricians, your psychologists, psychiatrists, your neurologists will diagnose autism. So first, you will see deficits in social communication. A lot of our children in the DevPed clinics will present with speech delay. And that's the first thing that parents will notice. So una, they'll notice, oh, ba't hindi tumitingin sa akin yung anak ko? Bakit hindi pa siya nagsasalita compared to the other siblings? Why is this child not talking to me, why are there no words? Why is this child not pointing? Why are there no gestures? So those are some symptoms that parents will see initially. So it's social communication, there's language delay, and usually there's that history of delay in social skills as well. The child will not look at you when you call, they will not respond to their name, or it seems as if they do not recognize their name. They have difficulty in connecting with other children or even with their caregivers. So those are the first symptoms that we see. And then the second criteria is restrictive repetitive patterns or behavior. And this is why you will see hand flapping, lining of toys. You will see that they like routines. Included here would be picky eating. They will only eat one type of food, or they prefer this kind of texture. This is why they have certain sensitivities to sound, to sight. They will cover their ears if they hear the motorcycle, or if they hear like certain commercials in TV, in the television, they become, they have tantrums, or those are the behaviors that we see. But it's important to also note here that eating and feeding is very important, and sometimes it's sensory processing that's the reason why they have some of these behaviors as well. We put in the level of severity when we diagnose a child with autism, 1 being the milder forms of autism, and level 3 being the more severe forms of autism, where you will see delays, and where you will see children having difficulty with activities of daily living, not being able to really integrate them in a regular school setting. So your doctors will give you these kinds of level of severity. But those are, let's say, the gaps in development that we see. But on the other hand, we have to celebrate these children as well. And you will see that they do have their strengths. Sometimes we refer to it as splinter skills, but other times you will see that these are like things that they are good at. So these are some examples. Some of them may have exceptional skills in math or music. Di po ba? Sometimes we have a child who is non-verbal, who will not communicate with you, but when you give them a mic and you give them video, okay, they will begin singing in perfect pitch. All of a sudden, they know the words. So we see that in some individuals with autism. They have sharp memory. Sometimes they even know what day they were born. They remember what day they went to your doctor's clinic or to their appointment, and what you were wearing, and all of those things. No? They have intense focus on the task at hand. They have certain skills in the STEM area. They're very honest. They will tell you if they notice anything with the way you look, or I had one kid, parang ang sabi niya sa akin, parang looked at my pimples and started connecting the dots, 1, 2, 3. So parang you will see those kinds of behaviors in these children. They adhere to rules. So sometimes if you give them rules and you break the rules, they will call your attention to it. No, they have talents in different areas, and some of them are hyperlexic. They begin to read even before they can talk. No, so sometimes parents will come to us thinking na, oh, this child might be advanced in terms of learning, but when we do a full assessment, it's actually hyperlexia, because you'll see that the communication side of development may have delays. So, but we have to recognize, we have to be able to detect what they're good at, no? Especially as they grow older, because we want to use these areas of strengths to support or to scaffold their deficits in communication or in their social skills. These are the types of intervention that standard of care will require us to suggest to our patients, or these are necessary interventions that we have to give them so that they will continue to develop well and that they will thrive in their environment. We talk about educational intervention, we talk about behavioral therapy, so yung mga nag-ABA po dyan. We have our occupational therapy or speech and language therapy. We have physical therapy. Minsan po nakakalimutan natin in autism yung need for physical therapy. But we know that a lot of them may have low tone, they have poor coordination, and these are skills. Or even when they talk, minsan po hindi nila nalalabas yung sounds. They're not able to produce the sounds well. So sometimes it's a motor problem. It's not just speech and auditory processing, no? So we have to look into that. We have social skills training. So we have a lot of interventions. Let me just go back po kasi we have a lot of teachers here. When we talk about educational intervention, dyan po yung role ng mga teachers natin. So welcome po kayo at nandito kayong lahat ngayong umaga. So meron tayong SPED teachers, and because our DepEd actually requires us to do inclusion or mainstreaming, our regular teachers are equally important because they are the ones who receive our children with autism in the regular classroom. No? So educational intervention is very important. So as parents, it's very important that they create a team around their child. And these are the recommendations, allowed around 25 hours of structured intervention per week. And sometimes this is the difficulty of our parents, knowing that everything here in the Philippines is out of pocket, no? So dahil po hindi nila ma-afford yung ganong kadaming intervention per week, or hindi sila maka-enroll talaga dun sa school na kumbaga mas bagay kung saan yung current skills ng anak nila, follow through at home is very important. Kaya parent training, parent empowerment is very important, knowing the limited resources that we have locally. So as teachers, hindi lang po natin role yung pag-alaga doon sa mga kids natin. Important, tinitrain po natin yung parents for follow-up, 'di ba? Kasi for follow-through at home, because they're the ones who really support their kids 24/7 for their whole lifetime. So important po that we empower the parents that we work with. So, while autism is believed to be psychological or behavioral, that was the belief before. Sabi po nila before, refrigerator moms, kasalanan ng nanay kasi hindi nila pinapansin yung mga anak nila. Hindi na po, na-debunk na po yun. Hindi na po yun yung talagang pinapaniwalaan natin ngayon. Ano? And we know more and more that there are biological reasons for the symptoms that we see, for the behaviors that we see in the clinic, in the classroom, in the home. And what is nice here is that we're beginning to appreciate that no two kids are the same, even if they're given the same diagnosis, even if they're siblings, even if they're twins, may differences po sila. And that is why we need to personalize the approach when we address children with autism or any disability for that matter. Okay? So there are biological bases. And some nga po, parang sinasabi nila secondary autism, they have autistic-like features because of a primary condition like neurofibromatosis or yung mga neurocutaneous syndromes po natin. So, pwede nilang mamimik yung symptoms of autism. And underlying, so ito po kailangan natin tandaan, underlying medical conditions can cause or exacerbate autism-like behaviors. Later, I'll give you an example for this po, no? Kasi minsan ina-assume lang natin yung tantrums niya or yung meltdown is because meron siyang autism. When in fact, meron pala siyang headache, masakit pala yung ulo niya, or may ear infection pala siya, kaya nagwawala siya. Di ba pag masakit ang tenga mo, masakit yung ulo mo, ikaw rin irritable. Minsan yung iba sa kanila, masakit yung tiyan nila kasi meron silang mga bad bacteria sa gut nila, masakit yung tiyan nila, and it comes out as behavioral. Tayo, akala natin, hindi, kasi may autism siya. Actually, if you look at studies, in terms of yung medical care for children with disabilities, sinasabi po nila, parang mas mababa yung quality of medical care for them because the assumption of some parents or some caretakers is that the behaviors that they're manifesting because they're non-verbal is because of the disability. Na-neglect nila yung biological or medical needs of these students or of these children. This is from TACA, yung the Autism Community in Action. It's actually a very good resource that we can refer to. You will see here that there are actually a lot of biomedical conditions that co-occur or are comorbidities of autism. So ito pong lahat nito, we need to look into these because what if they're reversible? What if we can do something about it? What if we just work on the diet and we see improvements? And more, we've been documented improvements in the symptoms of these children. Using the functional medicine framework. So in functional medicine, we use this framework and we see that there are physiologic nodes affecting the health of everyone, not just children with autism, even tayo po, even adults, even people with non-communicable chronic disorders, even yung mga may hypertension or diabetes, lahat po tayo, ito yung mga physiologic nodes or clinical imbalances that we look into. So what I usually say is that this is the role of their health providers to look into this, and we try to bring back the balance in the body. But notice that our parents can also do a lot in terms of modifiable lifestyle factors. So ang sabi natin, diet is very important. There's a big role that diet will play. Even kanina po, di ba, when we talk about detoxification, ito yung biotransformation and elimination, it's in this node, that physiologic node. Marami tayong magagawa. Yung sinabi ni Dr. Anjo kanina, we can start with prevention, we can start with cleaning the food, we can start with dietary intervention. Actually, you need to make sure that the gut is working well, the liver is working well, even before we can, give a full-blown detoxification program. Kailangan ma-assure po muna natin na kaya yung i-handle ng body. Kasi kung hindi, it will just re-enter the body through the liver if hindi po matuloy-tuloy yung detoxification process of this child, no? So kailangan all the way hanggang palabas po ulit, hanggang mag-garbage out ulit yung mga toxins in the body, kailangan po natin yung ma-support. And modifiable lifestyle factors are things that are free. These are things that can be readily accessible to us regardless of where we are, whether you're in Daet, you're in Illinois, you're in Manila. Ginagawa po natin talaga to. Tapos, we just need to be mindful and we need to know, we need to empower everyone that these are things that we can easily make good choices about. So, sleep and relaxation, we mentioned that. Exercise and movement. Yung iba sa atin, parang marinig lang exercise. Nako, hindi ko magagawa yan. Wala kaming oras to do that. But you can actually incorporate movement in your daily activity. Patulungin nyo yung anak nyo magbuhat ng labada. Or if you're going to bring your child to school, maglakad na lang po kayo. Just walk instead of riding the tricycle or riding the car to the school. That's a form of exercise as well. Tapos pinapawisan pa po siya, nagsasweat pa siya if they do that, no? So nutrition, we know that a lot of kids are picky eaters. We look into behaviors, but we want to also look into micronutrient deficiency because sometimes deficiency in zinc really makes this child more of a picky eater. And if we're able to supplement that, who knows if this child will try on a more varied and more diverse type of food, no? So we want to look into that. We look into stress. So inappropriate placement, let's say in school, let's say this child is having some degree of intellectual difficulty and you place them in let's say a regular class, expecting them to finish all the requirements, do their homework and all of those things. That's a lot of stress for this child. So even yung proper school placement can decrease the stress of these children, or even yung adjusting our expectations of the child can decrease the stress, no? And syempre, we can have mindfulness exercises or breathing exercises. We can teach them that, or even yung social skills training, because a lot of them would like to make friends, but they don't know how. So if you teach them the skill, a lot of times that decreases the stress level as well. And syempre, relationships. We know that these children have a hard time socializing. So is there a way of scaffolding it? Anong role ng teacher para itong child with autism can have friends in school? Can you assign a body to make them eat together during lunch? Or can you teach them social skills, how to greet people, appropriate ways of playing? Yun yung ginagawa ng mga occupational therapists natin. So you see this whole matrix and you will see that everything affects children with autism. Now, there are more and more studies saying that combining medical treatment or some biomedical approaches with your conventional educational behavioral therapies is the most effective and fastest route to progress. Of course, they will improve with our standard of care, their therapies, but the reason, halimbawa po, why I went into functional medicine is because of the question of, can we do some more? Is there anything else we can do for these children, knowing that some of them, after years of therapy, have not improved significantly? Diba minsan meron tayong makikita mga bata, bakit parang ginawa ko na lahat, na-try ko na lahat ng tricks na alam ko or mga techniques na alam ko, hindi pa rin siya nag-i-improve. Ano kaya yon? So, it makes us put on that curious hat na, is there anything else we can do for these children? And this is something that we want to put forth. So what is functional medicine? I would say it's functional or integrative medicine. Sometimes they will refer to functional medicine as somewhat similar to integrative medicine. Meron po silang similarities, but this is how it's defined. So it's a systems biology-based approach that looks into root causes. All of these behavior have root causes in the same way that our ABA therapists will tell you about the ABCs of behavior. We also want to investigate the biological reasons for the symptoms that we see. Kasi if we don't look into the root cause, it's like we're just putting band-aids. We're just addressing the behaviors that we see in this current time. But we know that after we address this, it will manifest in some other way. No? And you will see that these are the symptoms. So again, this is from Developing Child series, and you will see more and more na it's being put into mainstream, how we look into the biological systems when we talk about child development. So functional developmental pediatrics is standard of care. So this is standard of care. We do a history, you do a physical and neuro exam, you do our interventions, educational, our therapy services. We treat comorbidities, we have medications to do that. But we also look into the preventive and promotive side of healthcare. So diba Dr. Andrew mentioned earlier, the first thing and the most basic thing we can do is to prevent the entry of garbage into children. So in the same way, garbage, I would say, is not just the toxins in the environment. Garbage in terms of food is still garbage. So yung mga junk food natin, hindi po sila talaga junk food kasi non-food yung mga yan, junk lang sila. So if you look at it, it's actually garbage in to our kids as well, diba? And that's you can prevent doing that. It's within our power not to buy junk in the grocery when we do our shopping. It's within our power to not charge the iPad of the child or the cell phone of the children. So, meron po tayong really ways of preventing yung worsening of the symptoms of children. And then, on the other side of functional medicine is precision and personalized healthcare. Ito po yung medyo mahirap for us because it's very expensive sometimes to have the lab the specialized lab tests done. And a lot of these labs are done abroad. But we do have some basic labs available. So halimbawa, our CBC can tell us if children are iron deficient or if they have small cells, it might give us a hint of some lead, elevated lead levels. Or if they have some allergies, makikita nyo portion of the CBC, yung eosinophils, tumataas po. So, meron po tayong mga hints na maaari din nating makuha from the basic labs that your doctors can do. Or thyroid tests are very accessible to us. So, computing for conversion of T4 to T3 is something that your doctors can do as well. No? Yan. So, a core element of functional medicine is this, and I just want to put it here. We have a lot of tools available to us that we can use, syempre with different capacities and adjusting this to the needs of the children that we serve, no? Diet, nutrition, exercise, movement, stress management, sleep, and rest. So these are the modifiable lifestyle factors that I mentioned earlier. A lot of times, it will really take a lot of effort because it involves behavior change. So kailangan po medyo decidido tayo, or we have a lot of parents who will really push for this, and we have to support them as professionals, no? As barangay health workers, role po natin, kamustahin din, kamusta ba yung mga magulang para makita natin that they're enforcing this, yung mga decisions nila to modify some lifestyle factors. We have supplementation, so phytonutrient supplementation, nutritional, pharmaceutical supplementation. Iba-ibang options po yun. And when we talk about phytonutrient supplementation, actually, we start with food. Even before we supplement, remember, when we say supplements, supplement pandagdag lang po siya. It's something that you use to add on to your diet, no? Kasi yung iba naman, sige, hindi ko napapalitan yung fast food ko, bibigyan ko na lang siya ng vitamins. That will not work. Kasi your vitamins are just additions to the good nutritional practice that you're doing for your child. And then restorative and reparative therapies. Therapy natin, OT, speech, ABA, social skills, yung mga psychological intervention, CBT, DBT, lahat dami pong parang alphabet soup siya, ang daming initials, but all of these are therapies that we need to provide to the child, because these therapies are the ones that will teach this child new skills. So ang ginagawa po, if we are able to, let's say, decrease the inflammation in these children, prepare their bodies by making them feel better, then they're more receptive to the therapies, to the teaching, to the learnings that we try to impart on them. Let me give you an example. So kanina, Dr. Andrew talked about toxins and elimination, biotransformation, na mention po ni Dr. Andrew earlier, no? So ito, I just wanted to give you an example. And this is a very common symptom that we see in children with autism or other disabilities. You know, alam niyo po ba, do you know that around 46 to 85% of children with autism they've been reported to have gastrointestinal symptoms. Minsan hindi natin pinapansin, ay kasi constipated. Minsan, ano ba yung constipated? A lot of parents, meron po akong mga parents na nakikita, siguro 5 years old na yung parents. And then, ang sinasabi nila, kasi my child keeps on drinking milk. Milk lang siya ng milk. Kaya yung dumi niya, yung poop niya, lusaw pa rin. So parang pag makita mo yon, sadali lang po, hindi po normal for a 5-year-old to have watery stools. Hindi na po yun normal. But all this time, the parents thought, ay, normal pa pala yun. So when you educate them, they find out, hindi pala normal yun. So what can I do about it? Diba? So a lot of them may have watery stools, diarrhea. A lot of them may have chronic constipation. So every 3 days sila dumudumi. Anong effect nun? Diba sabi natin, ang gastrointestinal tract is an organ for elimination. But if they're not pooping, hindi sila dumudumi every day, anong equivalent nun? Para po silang nakaupo sa invernal. It's like they're sitting in their sewage kasi hindi nila nalalabas yung dumi nila. Di po ba? So, kailangan talaga, pati yung pagdumi nila, tinitignan natin. A lot of them may have abdominal pain, meron po silang vomiting or dighay sila ng dighay, they keep on burping or parang bloated. Ito, ewan ko po kung ano, pero meron ako mga patients, kinikwento nung nanay nila, parang sobrang baho nila pag umutot. They have smelly, stinky farts kasi parang nabubulok daw yung tiyan nila. So pati yon, you have to pay attention to that po, no? So gastrointestinal disorders. A lot of them, hindi, kahit na gastrointestinal yung main concern, hindi yun yung presentation nila kasi hindi naman nila masasabing, I have a tummy ache, mom, or I keep on burping, mom. Or, di ba, hindi nila masasabi yun. So, ano yung nakikita nila, especially for children with nonverbal? They may see self-soothing behaviors. Ano example nito? If you look at the right, parang they press their tummy on furniture. Yung parang naka-bend silang ganyan sa sofa nila or sa edge of a furniture. And because it relieves the pain. So, kaya yun yung ginagawa nila. Or yung iba, kaya sila parang nagra-rock. Kasi rocking or repetitive behavior can be very regulating. Natutulungan sila magkalma kung ginagawa nila yon, di ba? So on one end, that's what we can see. On the other end, we begin to see aggression, or they're very irritable, or sinasaktan nila yung sarili nila, they pinch themselves, or they bite their hands when they're in pain. Trying to find a way of relieving themselves from what they're feeling, no? So again, very non-specific kasi nga non-verbal sila. They can be hitting you or yung mga kapatid nila or yung mga kaklase nila. Kasi masakit na, meron silang nararamdaman. They're not feeling well, no? So it's our job as caregivers to try to investigate. Bakit kaya ganito yung behavior? Is it something na, is there a medical reason for the behaviors that we're seeing? We do a physical exam. We look for tenderness when we see them in the clinic. Actually, ang ginagawa namin talagang systemic exam, no? So even if diarrhea, yung presentation ng bata, pati we do a neuro exam, we do some physical, we check the skin, we check the mouth, the teeth, the tongue, the nails. You want to look for micronutrient deficiency. So you do a systemic exam, physical exam. This is the Bristol stool chart. So ito po, it's a simple chart that can give us an image of how gut health is. Kasi 'di ba yung mga stool exams na pinapadala natin sa States, maganda po siya kasi very precise. Makikita natin yung resulta doon. Nakikita din natin what the microorganism will react to. So I think that's very good, no? If the parents can afford it, di ba? But if not, we can actually, let's say, use this stool exam. So sinasabi nila type 3 and type 4, yung normal na stool. So ang minsan tinatanong ko sa mga parents ng mga kids na nakikita ko, araw-araw po ba siya dumudumi? So, yun yung unang tanong. Pangalawa, pag dumumi po ba siya, parang sausage ba to or parang bato? Is it like rocks or is it like sausages? So, ang gusto natin, parang sausage siya. Gusto natin once or twice a day na parang sausage, dumudumi yung bata. Okay? Kung halimbawa, type 1, parang bato, ang hirap ilabas, ay constipated siya, hindi yan maganda. On the other hand, pag liquid, walang solid pieces, then parang diarrhea yan. So, ayaw din natin ng ganun. These are examples of some special labs that we will see. And yung mga doctors po will give like interventions for some of these results that we will see if we do get access to the special labs. So ang main goal natin as health professionals, as teachers, as parents, is to help the body to heal and restore the balance. That's the beauty of our human body. If we give it time, if we support it, the body is able to heal itself. So, yun yung kailangan nating mabalik to restore that balance. And that's the challenge for us. Ito po yung ginagamit namin, yung 5R framework for gut health. I tried to highlight those that we can easily do, even when you go home after this talk, or maybe tomorrow if you want to prepare your pantry or yung ref nyo, i-prepare nyo. This is something that you can already do at home, no? So, na-mention din po ito ni Dr. Andrew earlier, removing refined sugars, remove processed food, at saka yung mga food coloring because these are highly inflammatory. You want to increase fiber for a lot of reasons. Yung gulay po, lalo na if you eat a rainbow, ibig sabihin ng eating a rainbow, iba-ibang kulay ng gulay every day, that gives you different forms of micronutrients that support the system, the methylation system, the detoxification system that was mentioned earlier by Dr. Andrew, no? So, increasing fiber, yung fiber po, pag halimbawa, start natin patayin yung mga bad bacteria or yung bad na amag sa tiyan ng mga anak natin, pagsabog niyan, gusto natin may fiber na didikit dyan para mailabas nila yon sa katawan nila, no? So yung fiber, so gulay is actually very important because we want to address dysbiosis. There are different types of diets, pero yung pinaka-simple po na sinasabi natin or nire-recommend natin is yung GFCFSF diet, gluten-free, casein-free, soy-free diet. But there are other special diets na maaari ding matry depending on the need of the child. Hindi po siya madali mag-GFCFSF diet, pero very doable po siya. It's a matter of preparation. Kailangan po natin siyang paghandaan. Hindi yung, o sige mamaya GFCF ka na. Hindi po mag-work yun kasi magugutom yung anak nyo. Pero kailangan po natin siyang paghandaan at saka we just need to make parang in a way, parang political will po yan eh. Kailangan good choices talaga yung ginagawa natin at pinapanindigan natin na ito yung gagawin natin kasi lifestyle change po yung hinihingi. There are instances when we need to replace kasi halimbawa, there are some kids who have been on proton pump inhibitors, yung mga binibigay po nila sa mga hyperacidity, no? So kung matagal, and yung ibang mga babies pa lang binibigay na to kung meron silang regurgitation. So alam mo, kulang, pag meron kang proton pump inhibitor, nagkukulang yung gastric acid mo. Kailangan mo to digest. Kailangan mo ng digestive enzymes kasi pag kumain po tayo, hindi enough nakakain lang tayo. Our body needs to be able to digest it, to absorb it, and to assimilate the nutrients. Kung leaky gut po yung bata, parang hindi po niya na-absorb yung mga nutrients na kailangan niya. Ang pumapasok po, yung mga malalaking protein na lalong magkukos ng inflammation. So, kailangan talaga ma-heal natin yung gut ng bata, no? So, digestive enzymes, hydrochloric acid, tapos supplements, yun po yung some things that we give. And then, we want to increase the diversity of vegetables and fruits. Note po vegetables ang mas gusto nating unahin kasi minsan yung mga fruits po natin mataas din ang sugar content. So, kailangan po, yung iba kasi sinasabi, nag-fruits and vegetables naman. Tapos pag tingin mo, ay puro fruits pala, wala yung fiber na nakukuha sa vegetables. So, kailangan, again, may balance din po yan. Re-inoculate. Kasi 'di ba, ang sa gut po minsan may mga bad bacteria na nabubuhay, yung microbiome na minention ni Dr. Anju parang nasira because of exposures or toxins or dahil dun sa food na kinakain natin. Kailangan maibalik natin yung good bacteria, and that's re-inoculating our gut and making sure that this good bacteria in the gut are supported through our diet ulit, or yung mga prebiotics na sinasabi natin. 'Di ba, sa iba-ibang regions naman natin dito sa Pilipinas, meron tayo iba-ibang types na gumagawa ng burong hipon or cabbage, ginagawa na fine-ferment natin, atsara, kimchi. Ito po yung mga some examples of food that can support the microbiome of our children. Yung next R is repair. Kasi isang theory po dito, yung leaky gut, 'di ba? And it's inflammatory in nature. You want to address that inflammation. Ano yung mga binibigay natin? Meron po tayong mga pwedeng ibigay na parang supplements din po, L-glutamine or collagen powder. Pero ang naisip ko po, isang madali nating pwedeng gawin, yung bone broth. Para po kayong naglaga na matagal na nilalaga at yung buto, ideally organic po, or kung halimbawa kayo nag-alaga ng chicken, yung native chicken na nandyan sa bakuran nyo, mas maganda po yun kasi sure tayo na walang antibiotics, walang hormones yung manok na yun, di po ba? Tapos yung buto nun, halimbawa kinain nyo na, nag-roast chicken kayo, yung buto nun, pwede nyong pakuluan, marami po itong mga minerals na makukuha, dagdagan nyo ng kung anong gulay, lagyan nyo ng asin, paminta para magkalasa. Tapos sinasabi nila, at least once a day, kung pwede, painumin nyo dun sa anak nyo. Kasi ang bone broth po can be very healing. Pwede pong parang tumulong siya sa repair ng gut ng mga kids. And then rebalance. So it's all about lifestyle na pag-usapan po natin. Getting adequate sleep. Dapat walang sleep-wake reversal. Yung mga bata, address po natin yun. Proper school placement. Lalagay din po natin yun. At saka finding ways. Paano ba nagre-relax tong batang to? Mahilig sila sa tubig, swimming. O di pag swimming natin sila, mahilig siya sa music. Isama natin yung music, singing and dancing, kung yun po yung nakaka-relax sa kanya. So mga lifestyle changes. So, in functional or integrative medicine, we are not changing standard of care. So, hindi po siya alternative, hindi po siya pampalit sa standard of care. Dinadagdagan lang po natin yung standard of care. So, dapat po malinaw tayo doon. Hindi enough na, magsisupplement na lang ako, hindi na ako mag-therapy. Hindi po mag-work yun. Kailangan sabay-sabay po natin ginagawa. Pero, ito yung maganda. Because of the concept of epigenetics. So, di ba, ang genetics, ibig sabihin, we are born with the genes na meron tayo. Kunyari, meron tayong genes na hirap with detoxification kasi mahina yung methylation na kulang tayo dito sa gene na to. Kunyari, yung MTHFR gene, kulang tayo dyan. Pinanganak na tayo na merong problema dun sa gene na yon. But because of epigenetics, alam natin, pwede nating ma-modify yung expression nitong gene na to. And knowing that as parents, as caregivers, as doctors, meron tayong pwedeng magawa. Then that gives us hope. Alam natin na kahit, mahirap tong place na pinanggagalingan nitong pasyente ko, nitong estudyante ko, meron pa rin akong matutulong. There is always hope that we can offer for this patient, no? So, yun po yung magandang tandaan natin na meron tayong magagawa. When you properly treat underlying medical issues, many associated behaviors decrease, or I have actually seen some children talagang nawala yung mga problem behaviors namin. They significantly improve outcomes and quality of life. So more than just addressing the symptom, quality of life, yung tinitingnan natin, quality of life of the child, quality of life of the caregivers and the people surrounding this child, no? So, autism is treatable. Maaari pong hindi siya curable, but we can treat it. There are things that we can do even at this time, even in our current settings. So, with that po, I will end my presentation. Maraming salamat po. Thank you for listening.
Okay, thank you very much, Dr. TP. Ma'am, let's open the floor now for questions, and we have already several questions. Let's first ask the question given by Mr. Patrick Collins Ditalo. Good morning, Doc TP. Is there an explanation on why persons with autism possess exceptional skills despite having difficulties on other areas?
Yung in autism po kasi, if you look at the profile, so meron po tayong iba-ibang domains of development. Tapos in some persons with autism, ang nakikita po natin, ang tawag po natin doon is yung uneven yung profile nila. Kaya yung iba sa kanila, magaling in one domain, pero hirap sila in other domains. So wala po tayo talagang explanation, pero yun po yung presentation na nakikita natin in some children with autism. So, yun po. Kaya yun yung minsan may splinter skills sila. So, and minsan po hindi natin na-discover yon until, sige, binigyan ko siya ng piano para mag-try mag-practice ng piano. Tapos biglang, ang galing pala niya tumutong. So, yun po minsan yung challenge for us.
I think Doc TP, ito yung sinasabi niya lang, the environment or God has a way to balance things out. Meron tayong shortcomings, pero meron tayo yung super exceptional naman.
Opo, yan.
Yeah.
Tama.
Yes.
God's wisdom.
Opo. For the next question, Doc TP, is from Lerma Baptisma. Good morning, Doctor. For adult persons with autism, who should we consult for diagnosis?
Usually po, tinitingnan natin kung ano pa rin yung main concern nyo. So usually, pag adults po, mga psychiatrists na po yung nagda-diagnose, no? But a lot of times, kami pong mga developmental pediatrician, kami rin po yung pinupuntahan ng ibang adults kasi po minsan pag may kakaibang behavior or hindi po ganun kasanay yung ibang mga psychiatrist. So, pwede pa rin naman po kami, pero kung halimbawa mas mental health, meron silang anxiety or depression, mas psychiatrist po yung pinupuntahan.
Thank you, Doc TP. We have an additional question from Laila Cayago. Doc, good morning po. Ask ko lang po kung nakadepende sa gender ng bata yung activity na meron siya. Meron po akong pinsan, dalawa po na 2 po ay may autism. Yung male pinsan ko po, mahilig siya mag-align ng toys. and dapat perfect yung pagkat ng letters and numbers. Then yung girl po, mahilig kumanta or nagha-harmony po. Salamat po.
Iba-iba po talaga. So kagaya nung minention ko, no two kids are the same. So kahit po, minsan nga kahit twins, makikita nyo ibang-iba pati yung personality nila, pati yung hilig nila. So wala naman pong parang dahilan bakit yun yung napili nila. It's just something that they're interested in, kaya paulit-ulit po yung nila, yung behaviors na nakikita.
Opo, thank you, Doc. So I think dito yung pumapasok, ma'am, yung binanggit nyo kanina, no, na especially the parents should really focus on finding out ano yung mga activities na nakakahiligan po ng kanilang mga anak.
Opo. Yan. Pero ano rin po, caution ko lang din. Kasi minsan, halimbawa, there are some parents, makita nila, ay, mahilig na sa letters and alphabets yung anak ko. And sometimes, wala na silang ibang toys na binigay dun sa anak nila, kundi letters and alphabets. So again, gusto natin may variety. So baka kailangan, try mo nga tong car naman. So kailangan i-alok nyo rin ng ibang bagay. Or why don't you try, let's introduce some books naman para hindi lang yung mga picture books naman. So again, parang meron pong mga techniques, and our therapists and our teachers here, I'm sure would know anong mga activities yung pwede natin i-offer.
Yes po. Meron pa pong mga nag-raise. Check lang po natin kung may additional questions. Opo, tawagan po natin Miss Irish, raised her hand. Ma'am Irish, kindly unmute po.
Hi, Irish.
Okay, nasa chat box daw po.
Ayun, okay.
Opo, lang po. Check natin.
Ako na lang magbabasa.
Sige.
I've been prompting my 4-year-old who was diagnosed with mild autism at 3. He cannot initiate conversations yet after hearing your discussion. Perhaps my son is currently dealing with a motor problem. What are some motor activities that could help us parents? Okay, sige. Alam niyo po, sometimes we have to look back at the sequence of development. So if you look at sequence of development, big muscle groups develop earlier than small muscle groups. So if your child has weak core muscles, mahina yung muscles sa gitna, yung sa trunk, yung sa abdomen, minsan kaya kahit na anong training mo ng handwriting, hindi siya makakasulat ng maganda. Or kahit na anong gawin mo na speech activity, hindi siya makakasalita agad kasi the bigger muscle groups are weak. And minsan, kagaya nung sinabi ni Dr. Andrew kanina, your mitochondrial dysfunctions can actually account for that. Mitochondria, powerhouse of the cell. Meralco yan ng mga cells natin, di ba? Kung mahina yung meralco ng cells natin, paano magkakaroon ng lakas yung muscles natin? Paano yung motor tone natin? Paano yung pag-coordinate niya ng movement? Diba? So, yun yung kailangan nating i-investigate. So, minsan ang sinasuggest ko, tignan mo rin, ano yung play activities ng anak mo? Baka may outdoor play ba? May parang for coordination? May muscle building ba? Or yung iba kasing kids natin, diba? Ano ba uso ngayon? Video games na rin sila. So, nawawala yung movement and and yung mga play activities natin. So, those are things that you can probably look into. So, play, sports activity, if you can put your child into those, kung walang therapists in the area. Kung may PT, baka kailangan ma-check siya ng PT. Or kung halimbawa, ano yung natural environment? Meron bang swimming coach dyan? Pwede bang ipasok natin doon? So, work on the big muscle groups and then tignan natin kung mapapa-improve natin yung small muscle groups. And then later on, yung mga oromotor exercises, pati feeding, kailangan nag-chew yung bata kasi nagpa-practice din yung mga muscles na ginagamit for speech.
Doc, ayan. Sige ha.
Doc TP, meron po doon sa chat box coming from Jonalyn Sinobio. Jonalyn Sinobio. Nakikita ba sa newborn screening na ang bata ay meron ng sakit ng autism?
Okay. Actually po hindi. Kasi in newborn screening, di po ba parang medyo limited po. I think 12 ba? Hindi ko lang matandaan ngayon kung ilan yung mga diseases lang that can be identified by newborn screen. A lot of symptoms of autism po, lumalabas yan mga 1.5 to 2. Kasi language yung kadalasang nakikita ng parents. Kaya rin yung ibang bata, yung sinabi ni Dr. Andrew kanina, di ba? They were developing well and then 15 to 18 months, uy, bakit biglang nag-regress? Dati kinakausap na niya or meron na siyang mama, papa, biglang nawala. So yun po, nakikita natin at a later age pa, mga 1.5 to 2 years old. No? So hindi po yun makikita in newborn screen. Yun po.
Yes, yes, Doc. Doc PP, meron rin pong question dito si Lucille Donato. Question po, I'm giving ascorbic acid with zinc to my child as supplement. I observed that it helps him to poop regularly, but then may na-encounter akong video na nakaka-produce din daw ng kidney stone yung palaging umiinom nito. Ano po ba ang tamang dosage nito?
Opo. Well, meron po siyang mga recommendation, depende rin po sa edad ng bata. No? So, yung zinc, halimbawa for kids, mga 15 milligrams per day. Ang ascorbic acid, yung iba po, depende po sa edad, pwede na po yung mga 500 milligrams. Kaya lang, ito na naman, kaya po kailangan i-personalize natin. Kasi maraming children with autism, mataas po ang oxalate level nila. Yung oxalate po, siya yung na-form na parang kidney stones. And minsan, yun nga po, yung vitamin C becomes parang lalo nga pong magpo-form sila nun. So, kailangan din po natin tignan yung diet nung bata. So, that's a factor. At saka po, kasi halimbawa, kung halimbawa maganda yung diet ng bata, nakukuha niya tong mga nutrients na to even with the food that he will eat, no? Kahit hindi natin i-supplement. Tapos ako ang caution ko lang din po kasi maganda po na makita natin kung ano yung mga supplements natin. Kasi kung halimbawa, marami tayong mga supplements, masyadong matamis. So, it's very sweet and it's very highly colored. Di ba, gusto po natin sana mabawasan yung food coloring. Gusto natin mabawasan ng refined sugar. So, kaya kung halimbawa, kaya naman natin makuha sa pagkain ng anak natin through, let's say, vitamin C, oranges, or lemon, or calamansi, ano pa nga ba yung meron tayo dyan, mga citrus fruits natin. Then yun yung first na pagkukunan po sana natin ng mga micronutrients nila.
Doc TP, meron pa pong questions from anonymous attendee. Good morning, Doc TP. I have a cousin po kasi na may autism. We can't make conversation with him po, but he can speak some words and understand us. He's very good in animals and memorize all the songs he's been watching ever since his parents gave him a phone. Is it okay for him po to use phone at his very young age of 2? Kung dun siya natutong magsalita, he's been being addicted po kasi sa minsan kinukuha ko po ang phone and nililibang. Opo.
Okay. So, hi cuz. Very good cousin. Very aware siya sa kanyang pinsan. Ano? Several things. Importante kasi in all children with disabilities, we assume competence. Hindi natin, ay wala yan, o hindi niya alam, o hindi niya matututunan. Dapat hindi ganun yung pagtingin natin sa kanila. Dapat makita natin, ma-assume natin, alam na kaya to, naiintindihan kaya niya tayo. Dapat ganun yung ano, or ituturo ko pa rin to sa kanya kasi minsan nagugulat tayo. Ako personally nagugulat ako minsan kasi makikita ko dun sa mga scores namin, bakit parang ang baba? Tapos biglang, uy, alam niya pagbalik niya. So, yun yung number 1, kailangan nating ma-assume na that they're competent, no? Number 2, yung tanong mo tungkol sa screen time. Meron tayong mga recommendations for the use of screens. Ideally, 18 months and below, walang screen time yan. Yun pa rin yung recommendation po. More than 18 months, sinasabi nila, pwede kang mag-video call kung halimbawa ang kausap mo, let's say dad niya OFW, kasabay niyo sa video call, pwede siyang gumamit ng ano, but it has to be supervised. Kailangan po, kumbaga, may kasabay na nanonood. Meron nga po tayong study gawa ni Dr. Angel Dina on the effect of screen time on child development. Pag na-publish po, i-share namin yun sa inyo. Malapit na. So, dun nga po, makikita nyo, malaking effect din sa language yung technology, no? So, tapos meron na nga po tayo ngayon, napapagkamalang may autism ang ibang bata dahil sa screen. So dahil yun, hindi naman kasi tayo tinuturuan makipagkaibigan sa screen time or ano sa cellphone natin, or halimbawa pag tinanong mo yung pinapanood mong Cocomelon, kunyari, hindi ka naman niya sasagutin. So hindi po nade-develop yung skill ng bata. Pero it's not to discourage the use of technology, but we need to use technology properly. So kung talagang manonood yung bata, kasi doon siya naman talaga may natututunan, sabayan niyo po. Make it interactive. Gamitin niyo na parang libro yung cellphone niya. Parang, uy, sino yan? Tinatanong niyo rin to encourage language, to encourage yung may conversation pa rin. So, pwede po natin gamitin to our advantage within limits. So, yun po yung kailangan yung kausapin yung nanay niya. Kasi po, syempre, cousin lang tayo. Si mommy pa rin at si daddy yung magde-decide what is best for the child po.
Maraming salamat, Doc TP. So, we have more questions. I hope okay lang po, Doc. Ito, medyo short. Madali lang siguro ito. Is it true po, Doc, that too much sugar contributes to hyperactivity of a child with autism?
Ang sagot ko po dyan, pag maghanap kayo ng mga randomized controlled trials, and ito maraming sinasabi mga doktor, ang sinasabi po nila, mga randomized controlled trials, walang effect ang sugar sa hyperactivity ng bata. Pero, kung halimbawa, makikita nyo po, pinainom nyo kunyari ng soft drinks yung bata, tapos nakita nyo sobrang likot, hindi makatulog, bouncing off the wall, sobrang daldal, hindi po ba kayo magsususpecha na baka itong sugar may effect dito sa anak ko na to? 'Di ba? So, yun po yung role natin. Kayo na po yung mag-decide na, hindi, nagiging hyper talaga tong anak ko kapag nakainom ng Tetra Pak ng kung anong juice or kung nag-soft drinks nga po. 'Di ba? And avoid nyo na yon. And syempre, for a lot of other health reasons. Ang sugar, lalo na yung high fructose corn syrup natin na nakalagay sa mga Coke natin is very inflammatory. Pati sa mga matatanda, nagpapataas po yan ng uric acid nyo. So, di ba i-avoid natin? And kung sa matanda nga po, i-avoid nyo, edi mas lalo po sa bata, kailangan natin po siya ma-avoid.
Ito pa po, isa pong question pa. Any
Sabi po
tips or
nating tanong
Opo, any tips or technique para sa pag-encourage at follow-up ng parents sa mga therapy goals? As speech therapist po, kasi this is one of my struggles since most of the reasons ay hindi nila makontrol or mapasunod ang bata with ASD.
Okay, encourage techniques for follow-up. Ako siguro, teach, ang gagawin ko, break it up pa into smaller chunks. Kasi, di ba, bawat parent, bawat home environment, iba-iba kasi yung situation nila eh. So, minsan, ang sinasabi ko sa parents, parang i-assume nila na meron silang isang space sa bahay na, pag nandito tayo, mommy teacher ako. In the other part of the house, halimbawa sa bedroom, lambingan time sila or maglalaro sila pag nasa sala. Pero pag study time na, doon dapat mas firm si mommy, merong structure, may schedule na predictable in this particular small space kung saan sila nagfo-follow through ng mga exercises nila. Pero alam mo, teach, ang isang nakita kong pinaka-effective dito is that the parents need to build relationship. They have to start with that. Hindi mo pwede, pati tayo as doctors, as therapists, hindi enough na, sige, gawin mo to, blank, 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 blank. Hindi pwedeng ganun eh. Kailangan ma-feel nung child na pwede niya tayo i-trust, na pwede niya tayong ikausap even if in a non-verbal manner. Kailangan may connection muna tayo with the child. Tapos, dun mo mas mapapasunod yung bata. Kasi kung puro utos tayo dun sa bata without listening to what this child is trying to communicate with us, minsan yun yung difficulty din ng parents kasi napapressure sila na, kailangan magawa na ito ng anak ko. Kailangan minsan step back, tignan natin, appreciate the child for the child, di ba, as is, regardless of ano yung current level of skills niya, ma-appreciate natin siya, and a lot of times doon nagsisimula talaga yung development, doon nagsisimula yung progress ng bata.
Thank you, Doc TP. Last question na po siguro.
Dami ng last
Opo, bakit po gusto ng batang may autism ang maligo lagi kahit gabi? Dapat po bang payagan sila lagi? Baka lang lagnatin or sipunin sila.
Okay. Actually po, hindi po talaga yung ligo yung ano nila. Minsan ang gusto nila yung sensation of water. Water, parang a lot of children with autism have sensory processing difficulties. So, ano yung mga nagpapakalma sa kanila? Tubig. Kaya di ba gusto-gusto? Di ba minsan tayo din, parang hugas ka ng hugas ng kamay mo, gusto mo, nagre-relax ka, yung tubig, ano. Or yung iba nga gusto nila nakaupo sila sa balde para, okay, dun sila nag-chill. So, kaya yun yung ano nila, way of regulating, yun yung pamparelax nila. Now, papayagan ba? Ang importante naman, 'di ba? Hindi yung nga sabi ng matatanda, wag pasukan ng lamig. Eh di tuyuin nyo agad pagkatapos ng ano, ng ligo, or pwede ba sige water pero medyo hindi ganong kalamigan, or bibigyan mo siya ng timer, o sige 10 minutes ka lang nakalublog dyan sa mini swimming pool mo, or 10 or 5 minutes lang yung ligo natin. So minsan pwede pong ganun yung gawin natin.
Okay. Maraming salamat Dr. TP Tanchanco sa pagbabahagi niyo po ng inyong kaalaman at syempre yung mga karanasan, lalo na po dun sa pagtugon dito sa hamon po ng autism. So at this point po, tinatawagan po natin si Ginoong Reynaldo San Juan, Executive Director ng Bantoxics, para magbigay po ng maikling closing remarks bago po tayo magtapos. At habang hinihintay po natin siya, paalala lamang po unang-una, para po dun sa mga kasama natin sa Zoom, kung maaari po ay paki-fill up po natin yung ating evaluation form. Ito po ang magiging batayan para po sa pagbibigay ng certificate sa inyo. At gayon din po, inaanyayahan po namin kayo na i-like at i-follow ang aming Facebook page, Bantoxics. So paki-check na lang po siya. At okay, nandito na po si Kari.
Magandang umaga po sa inyong lahat. Dr. TP, my God, napakagaling. I'm so impressed na talaga pong to the heaven po ang pasasalamat ko sa inyong dalawa ni Dr. Anju. Talaga pong napakarami naming natutunan, napakarami pong bagay na nagbigay ng kamulatan at kaliwanagan po sa amin. Napakaganda po, very well said po na sinabi niyo na combining medical treatment and therapy is very important para po sa treatment, yung multimodal treatment plans. So, hindi lang para simple pagtanggap, pag-deny, accept na ito, ang anak ko ganito, yung pinsan ko kasi may ganito, yung anak ng mga pinsan ko ganito, hayaan mo na, kawawa naman. It's treatable, and that is the best word that I heard sa umagang ito, na may pag-asa. At sa mga normal naman, sinasabi nga kanina na mga normal na bata ay hindi dapat maging complacent o hindi dapat na maging komportable na sige, ma-expose kayo, maglaro ko kayo kung saan po pwede rin pala ma-develop yung ganitong klaseng sakit sa kanila. So napakarami po namin natutunan at talaga pong kahanga-hanga ang dedication ninyo, as mentioned by Dr. Anju. Kitang-kita po sa inyo, Dr. TP, kung gaano yung inyong puso ay talagang bukas na bukas at napakalaki para po matulungan ang mga bata at ang lahat ng mga magulang. So, as you mentioned earlier po, doon sa nagtanong, si Pinsan, sino man si Pinsan, napakaganda po ng kamulatan na yon kasi yung awareness ng magulang at yung keenness to observe kung anong ginagawa ng anak ay napakahalaga. So, ito pong webinar na ito ay hindi lang po matatapos sa oras na ito, sa umagang ito. Ito po ay naka-record at umasa po kay Dr. TP at Dr. Anju na we're going to share this webinar sa maaabot po ng ng Bantok 6. And I'm also asking all the participants to please visit our Facebook page, Bantok 6 Facebook page. Nandoon po yung kopya, nandoon po yung link ng webinar na ito sa YouTube, nandoon po. At i-share po ninyo, napakaganda, napakalaki po ng bagay na matututunan nito. And I hope lahat ng mga magulang, no exemption, lahat po ng magulang, may anak man sila o may kamag-anak man sila mayroong ASD o may autism, ay dapat mapanood itong webinar na ito. At siguro po hihilingin ko po Dr. TP at kay Dr. Anju and Ma'am Marilu, this will not be the last webinar that we will have to discuss this topic and related topics sa chemical, ito po mga toxic chemicals and toxins. Sana po ay patuloy niyong tulungan kami, ang Bantok 6 po, na ipaalam at ipamulat sa maraming tao kung gaano ka ang idudulot na kapahamakan ng exposure sa mga toxic chemicals. Muli po, maraming salamat. Pagpalain po tayong lahat at ibabalik ko po yung floor kay Sir Eric.
Maraming salamat, Kari. Sa punto pong ito, sa ngalan po ng Bantok 6, lubos po kaming nagpapasalamat at sinamahan niyo po kami muli sa isa na namang makabuluhan na talakayan ukol sa tamang kamalayan ukol sa autism. Tulad po ng binanggit ni Kari, hindi po ito ang huli na pagkakataon na pag-uusapan po natin ang autism. Asahan niyo po magkakaroon pa po tayong mga karagdagang pag-uusap at talakayan ukol sa napapanahong paksang ito. Nawais gayon din po, binabanggit po namin sa inyo na kung maaari po ay tulungan niyo po kayo at suportahan ang aming Facebook page sa pamamagitan ng pag-like at pag-follow. Wag po natin kalimutan muli i-fill up yung ating evaluation form na pinost na po natin dito sa chat box. Ito po ang magiging batayan para sa pagbibigay po ng inyong mga sertipiko. At hanggang sa muli, ito po ang inyong guro para sa kalikasan, Kuya Eric, na nagsasabing
Sir Eric.
Opo.
Guro para sa kalikasan.
Sir Eric.
Opo.
Pwede bang mag-picture muna tayo ng Dr.
Ay, oo nga po pala. Pasensya na po. Sige, kung maaari po, inanyahan natin yung mga nandito pa po sa ating Zoom na pakibuksan po ang ating mga camera.
Ma'am Marilu.
Okay, gallery lang po tayo. Ayun.
Outdoor na si Ma'am Marilu.
Opo, sige.
1,
1, 2, 3.
Smile. Dr. TP, maraming salamat po talaga.
Maraming salamat
po sa
po.
oras po
Thank
ninyo.
you.
Napakahalagang oras na ibinigay niyo sa amin. Ma'am Marilu, thank you very much.
Ma'am Marilu, thanks for organizing po. Maraming salamat.
Maraming salamat po.
Paulan na po ako. Thank you.
Thank you po. Check to the food. Once again, i-share ko po yung pong ating dali lang, i-share ko lang evaluation form.
Hindi pa po nakapag-fill up ng ating evaluation form.
Okay. Thank you.